Hey friends, this is an impromptu TED Talk disclosure disclaimer with no teleprompter. So, going by what I know and no AI robot. Very important here for your peptide health. Anything that causes angiogenesis or growth hormone release, things like that. Um, really good idea not to have had a history of cancer, right? Because we just don't know. You're going to see that come up a lot. Those are one of the main things that we're cautious and screen people of. And some of the questions that comes up during consultations that I get asked is, well, how do I know if I have cancer? Like, can you screen my body? And unless you have had a recent CT or a PET scan or things like that, there's no way to really know 100% for sure whether there's any sort of cancer spread throughout your body or certain labs and things like that. And a good rule of thumb is just, again, this is disclaimer, this is for educational purposes only, and take this as a grain of salt, but put it in your factoring. If you've had cancer or you have a strong family history of cancer, you really need to think about the risks versus benefits on the peptide therapy that you're considering. Because we know that growth hormone levels decline as we age, and we know the benefits of growth hormone. And personally, BPC and Wolverine, which does cause angiogenesis, is wonderful for healing and joint and musculoskeletal conditions. And so, if you have those conditions and you've been suffering with them, whether acutely or chronically, you may be willing to try those things, whether you know you have cancer or not. If you've been living with a condition for quite some time and you don't want to be taking pharmaceuticals, you don't want to be on opioids, you want to try something that's the latest and greatest that you keep hearing about, really, like, you have your own free will as an adult to make your own informed healthcare decisions. That's the beauty of health choice freedom. And that's what we're here to give you, and this is an avenue here for you to have that. But it's also important that you are aware and that you are educated and that you take that power and responsibility for your health as well. So that's my little TED talk, right? So look at your risk factors. Look at your family risk factors. Are you up to date on your preventative wellness? If you're in your 40s and your 50s, you should be having some screenings for ladies, mammograms, your female reproductive, fellas, your PSA, right? Colonoscopies, all those things. You should be going to the doctor and getting regular lab work. All those questions are on the questionnaire. And I will also say this too, I educate people on this too. Before you just jump to peptide therapy, really look at your hormones. Because if you haven't looked at your hormones and addressed any sort of hormones deficits, and you start and jump into peptides, and a couple months in, a few months in, you're not getting the results that you think you want from peptides. Did you ever look at your hormones? Did you ever lab test your hormones? I personally, as an integrative practitioner, would start with a foundational level of good nutrients and foundational supplementation, because we just don't get everything we should from food. And then I would look at your hormones, and then I would sprinkle in the peptides, okay? And that's the approach I would take, okay? Right? For your longevity journey, it makes the most sense. Let's follow like a algorithm of foundation and then build upon it, like so. Like, don't start at the top and then work backwards, because also these therapies, you're paying cash for it out of pocket. You're spending a lot of money on and time that you're investing, and a magical shot or a troche or sublingual or patch is not just going to cure all your problems. You have to take care of yourself and show up for yourself and make some integrative changes and lifestyle changes, and that's also what we're here to help offer you as well, right? So it's a beautiful thing. But remember your disclaimer and your disclosures. Most peptides, most, not all of them, but a good majority of them, you want to look at your familiar history in cancer and, like, blood clotting, if you had anybody with polycythemia or any sort of abnormal blood condition, that would be another one. That would be a big one. And another thing that comes to mind is cardiac conditions, right? Because some of the research out there, there's not as much research with like atrial fibrillation and certain heart conditions. My disclaimer to you would be, have you been hospitalized for a cardiac condition or had a cardiac stent or a stroke, in the last 12 months? Be a little mindful. However, some peptides, especially some of these ones like C-Max and Selank that are coming out here and really healing the brain and showing some evidence on that, have been found to help heal TBIs and autism and post stroke. So there is some stuff out there showing some of that, but make sure you're looking those things up. When we get the educational cycle going and the blog posts going, hope to post some of that as well. But be mindful of that and be aware and take responsibility of what your health risks are and what your conditions are, and your informed consent and your voluntary participation in a peptide program. Your at-will voluntary participation in a peptide program as a grown adult that's been given plenty of information on our platform, that has the opportunity to ask questions and consult a provider and have counseling along the way, and know that you can at any time discontinue use and your program. Okay? Looking forward to working with you. Take care. Bye-bye. Be well now.